Okay, hi students. Today we are going to start our nursing classes for first semester students. Okay, if you are joined in any university, you may started to study these topics. If you are not joined, also you are planning to join, you took admission anywhere, also you can study as per the syllabus. Only I am taking classes. You know already in the first class which I uploaded yesterday, I explained what are the different subjects you have in the first semester. That is English, that is internal subject, and university exam only two paper contain four subjects. Okay, two subjects in one paper, like that. Okay, in that first paper is anatomy and physiology, and the second paper is sociology and psychology. Okay, these four subjects is very important. We will take classes. I will upload classes based on the syllabus very detailedly. I will explain, and I will explain for you. Okay, you can, if you are interested, you can watch and study. Okay, and you can share to your friends also if they are facing any difficulty to study nursing subjects. Okay, moreover, please watch it completely. If it is useful, please watch it completely. Don't skip the video. If you are skipping, no use. I'm explaining very detailedly. If you are getting time, if you are using your time and watching this video, you will be studying, you will be getting a good idea about this topic, and with no time sharing the classes. Okay, and one more thing, if you like the video, just like it. If you have any comments or like any suggestions, and at least you studied these topics, means I will feel very happy. After your studies, you just mention I finished, ma'am, or I studied, like that. You can put a message for me after seeing. Anyway, I will feel happy if you are using these videos and studying. Okay, and moreover, just share with the others also. And if it is useful, please subscribe our channel. Then it is more useful, and press the bell icon. If you press the bell icon, then you will get the notification when I am uploading the videos. Immediately you will get the notification. Okay, okay, we will continue. First unit I'm going to start. I'm going to start the anatomy subject. We have anatomy and physiology. Anatomy means, you know already yesterday class. If you didn't watch the first video, means yesterday which I uploaded, that you can go and see. In that I am explaining completely about the syllabus. Means first semester what all subjects is there, how much you have to study, how you can study, which book you can refer, like that I explained. If you want to know that, you can go and see the video. Okay, previous video. Then today onwards, you can see this is today day 1 for theory topics. Okay, this is the first unit of anatomy, introduction to anatomical terms and organization of the human body. That means you are going to study a medical field. What, to whom you are going to give care? To human being. Is it okay? You are going to give your care for human beings, so you should know what and all the structures are there in the human body, and what are the functions, and where it is located, how it is working. Okay, how we can take care, like that we have to study. For that, first you should know what and all is the structure. Simple, so many terminologies are there. We have to study that. Then we should know the organization. That means infrastructure. How each and every organ arranged in our body, where this particular organ is located. Like that, the structure we should know. Okay, location we should know. That only in this first unit you are going to study. I will explain you. If you already will be having a small idea, because you in your plus 2 course, so after 10 the plus 1 plus 2 you completed, anyway you would have studied biological science only. In that you may study these all systems, but here we are going to study very detailedly. Okay, very detailedly each and every organ we will study, organ and organ system. Okay, we will start. Are you ready? Okay, here, this is the syllabus. Okay, introduction to anatomical terms relative to position. First main topic here is, it's an introduction to these terms. Okay, these terms like an anterior, ventral, posterior, dorsal, superior, inferior, median, lateral, proximal, distal, superficial. Like that, so many words are there. You have to study. When we will tell this organ is superior to this one, when we will tell it is medially, when it will we will tell it is laterally, when it will be told as it proximal, like that we should know. And moreover, next one is different planes are there: axial, transverse, horizontal, sagittal. While you first, if you are seeing this words, new terminologies for the first time, don't be scared. It's very easy. I will explain you everything for you. Okay, and vertical plane, coronal plane, frontal plane, and oblique plane. Like there's so many planes are there. And this portion is movements. These all movements we will study in the fundamentals of nursing. And this there is no use in anatomy, only for musculoskeletal you will be studying. That time we will discuss that one. This one, you should, the first this much portion you should study very detailedly, and this only this third point we will study in the fundamental of nursing. Otherwise I will take in a separate class. Okay, next we have to study important topic, that is cell structure, and next types of cells and tissues, tissue classification, and muscles. So many things are there. These things also very important. You people will get in exam, public exam, people will get questions from these areas. These many topics you will get, definitely you will get questions. And in this first part on no, I told supposition. These things is basic. They will not ask you to write different position in the exam, but they will it is needed to study anatomy of each and every organ in our body. In our body, so many organs are there, so we should know where it is located, what is located superior to that organ, what is located inferior to that organ, what is located anterior to that organ. Like that we should study. For that I am going to explain this first point, first 2 points I will explain today, and next cell structure, classification, tissues, that and all we will see in the next class. For Malayali students, already I explained this chapter completely. I have taken classes in Malayalam explanation, and I already uploaded in anatomy playlist. Okay, you can anatomy and physiology playlist, it's there, you can watch that one. And if you need English explanation, means you can see this video. Okay, let's start. Here, a first look at the anatomy. What is mean by anatomy? You can see anatomy means it's a study of structure. Simple meaning. Anatomy means study of structure. When we are studying about the structure, then it is known as anatomy. What is the meaning of anatomy? Anatomy, the word derived from Greek language, and the meaning of that anatomy is to cut up, to cut open. This is the meaning of anatomy. No need to buy heart. Just for understanding, I'm telling. Anatomy means it's a study of structure, and the meaning of anatomy is to cut up or to cut open. Okay. Next one. Anatomists examine the relationship among parts of the body along with the structure of individual organs. Anatomist means who? The person who examine the relationship between the particular organs. Okay, individual organs. We have many organs. What is the relation between these two organs? Like that, some people will be examining. That person is known as anatomist. Okay, you understood? Anatomy means study of structure. The word meaning of anatomy is to cut open, and the anatomist means this is a person who examine relationship between the particular organs in our body. Okay, next one. Next, here we are going to see what is meant by physiology. Physiology means is a scientific discipline that studies the functions of the body. Physiology means the study about functions of the body, and how the saliva produced, how urine produced, how heart functions, how cell metabolism is happening, how energy produced, how digestion is happening. These are the different processes in our body. How it is happening, that only we are digestion happening in the stomach, and absorption happening in the intestine, that we know. That is that we will, what is in the stomach and what is the intestine, that structure we will study in anatomy, and the digestive process we will study in physiology. Okay, structure and function cannot be separated completely. Form is related to function. So structure and function is closely related. Both are closely related. Okay. Next, here, this is meant by levels of organization. Levels of organization. What is meant by levels of organization? This is a human being. Before forming a human being, this is smallest unit. Like there is some atoms. Atom, smallest single unit is atom. When atoms comes together, it forms molecule. Molecules comes together, it forms cells. Cells on similar cells join together, then it is called tissue. Tissue, with different types of tissue joined together, it forms particular organ. And different types of organ system joined together is called, different types of organ joined together, then it is called organ system. Then different types of organ system combined together, then it is known as organization. Organism. Organization, no, not organization, this is organism or human, like this. Okay, atoms comes together and forms molecules. Molecules comes together and forms cell. Same type of cell comes together and forms tissue. Different types of tissue comes together and forms organ, and different organ comes together and form organ system. Organ system, different organ systems in the human body, that is organism. Okay, that is organism. First level is atom. Atom forms molecules. Molecule forms cell. Cell forms tissue. Tissue forms organ. Organ forms organ system. Like that, an example I will tell you. Lungs is an organ. Lungs plus trachea plus larynx, nasal cavity plus nose, everything come together, we will tell respiratory system, that is organ system. Respiratory system, digestive system, reproductive system, muscular system, like that. So many organ systems are there in our body. These all body systems, organ systems comes together, then it is known as organism. Organism, you understood? Organism. Okay, this is our levels of organization. Next one, here I am just small explaining the same thing. Levels of organization of the human body. Similar, what I told now, same thing I am going to explain. I am giving note. The simplest level of organization within the body is chemical level, which is composed of atoms and molecules. Atoms are the smallest unit of matter. Smallest unit of matter. What is smallest unit of matter? That is atoms. And two or more atoms combine to form a molecule, such as a protein, water, vitamin. These are all formed by combination of these atoms. Okay. And next one, macromolecule, larger and more complex molecules such as DNA and proteins. These are all known as macromolecules. Okay, then in the cellular level, specialized structural and functional units called organelles permit all living organs to share some common functions. Large molecules join to specific way to form cells. Large molecules join together and form cell. The cell is the smallest structural unit, exhibits characteristics of living things. It's the smallest living portion of the human body. Next, cells combine and similar cells have a common function and form tissue. Okay, tissues are precise organization of similar cells that perform specialized function, that is known as tissues. Next, organs, different types of organs. Different tissue types that come work together to perform specific complex functions form an organ. Organ come together, then form a organ system. Organ come together and form a organ system. And all organ body systems combine together and form organism. This is all about levels of organization. Epithelial tissue covers composed of the tissues we will study later. Next, we will see, I told the bone body contain different types of Organ systems. Here are some of the examples for organ system. First one is integumentary system. You know that we have different types of organ system: integumentary system, respiratory system, digestive system, reproductive system, skeletal system, muscle system, nervous system. These different types of organ system is there. Okay, and here first one is integumentary. It's related to skin. The system related to skin, that is integumentary. This system provides protection, regulate body temperature, site of cutaneous receptors, synthesize vitamin D, prevents water loss. These are the protective functions or functions of integumentary system. What are they? Provides protection, regulate body temperature, site of cutaneous receptors, synthesizes vitamin D, prevents water loss. These systems we will study later, one by one we will study later. So no problem, you don't need to get tensed. Okay. Next, second system is skeletal system. It provides support and protection. It provides support where we can stand, sit, climb or roll over. What different activities we can do, because we have a good skeletal system, it protects us. And the site of hematopoiesis, or hematopoiesis means production of blood cells. Production of blood cells. Hematopoiesis, and it stores calcium and phosphorus, allows for body movement, generate when the muscles contract, and just produce in the skin produce proper body temperature also, and it produce muscle contraction also. And nervous system, the regulatory system is a regulatory system. Regulatory system means it's control body movement, and based on the response sensory stimuli, it will be responding. Nervous system is controlling other systems in our body, and it is responsible for consciousness, intelligence and memory. It is responsible for conscious, intelligence and memory. Next system is endocrine, consists of glands and cell clusters that secrete hormones, some of which regulate body and cellular growth, chemical levels in the body, reproductive functions. Next, cardiovascular system means heart and blood vessels. Okay, related to heart and blood vessels, pumping and storage, everything is under cardiovascular system. Next, lymphatic system. Throughout our body, we have lymph fluid or interstitial fluid, and it initiates immune response when necessary. And the respiratory system also helps to exchange of gases and carbon dioxide between the air and the lungs. And the digestive system mechanically and chemically digest food materials, absorb materials, expel the water products, expels waste product. Next one, urinary system uses our water and maintain the normal life. And if it is coming down low level, we have to like if any problem with related to kidney or ureter or urethra, it will be affecting urinary system. Next one, male reproductive system. കുഞ്ഞുങ്ങൾ ഉണ്ടാകാൻ വേണ്ടി സഹായിക്കുന്ന male reproductive system. If there is any problem or any hormonal problems is there, means we should know that. Okay. Next, female reproductive system. ഓക്കെ, അപ്പം നമുക്ക് ഇന്ന് ഇവിടെ ഇത്രയും ഓർഗൻ സിസ്റ്റമാണ് നമ്മൾ പഠിച്ചത്. ഏതൊക്കെയാണ് പഠിച്ചിട്ടുള്ള റെസ്പിറേറ്ററി സിസ്റ്റം പഠിച്ചു, ഇൻഡഗ്യുമെന്ററി സിസ്റ്റം പഠിച്ചു, സ്കെൽറ്റൽ സിസ്റ്റം പഠിച്ചു, മസ്കുലർ സിസ്റ്റം പഠിച്ചു, നെർവസ് സിസ്റ്റം പഠിച്ചു, എൻഡോക്രൈൻ സിസ്റ്റം പറഞ്ഞു, കാർഡിയോവസ്കുലർ സിസ്റ്റം പറഞ്ഞു, ലിംഫാറ്റിക് സിസ്റ്റം പറഞ്ഞു, റെസ്പിറേറ്ററി സിസ്റ്റം പറഞ്ഞു, ഡൈജസ്റ്റീവ് സിസ്റ്റം പറഞ്ഞു, യൂറിനറി സിസ്റ്റവും പറഞ്ഞു, മെയിൽ റിപ്രൊഡക്റ്റീവ്, ഫീമെയിൽ റിപ്രൊഡക്റ്റീവ്. നെക്സ്റ്റ് വി ഷുഡ് നോ ദ ഡിഫറെൻറ്റ് ടെർമിനോളജി. Okay, till now we have seen an outline of anatomy, physiology and the different organ system in our body. Okay, once again I will review previous slides. This is anatomy. What is meant by anatomy? Anatomy means study about structure of the body. Okay, and what is physiology? Physiology means study about function of the body. Okay, this is levels of organization Once different atoms comes together, it will form molecules. On different molecules comes together, it forms cell. Same type of cells comes together, it forms tissue. And different types of tissue comes together, it forms an organ. And different types of organs come together, it forms organ system. Multiple organ system present in our organism or in our human body. This is our levels of organization. Levels of organization. Okay, understood? Next, the same thing we explained in each and every level. Next, different organ system. I told different organ systems are available in our body. What are they? First one is integumentary. It's related to skin. Skin also. We are studying integumentary system in a separate chapter. Okay, we will study each and everything in that unit. And the another system is skeletal system on more organ system. This is related to bone. And another system is muscular system. And here we are studying muscles, different types of muscles in our body. Next organ system is nervous system. We will be studying about neurons. Okay, neurons, spinal cord, brain. We will study about that. It's very, very important system. Each and every system is very important. And the next system is endocrine. Here we will study about different glands and what are the secretions or hormones produced by glands and the functions of glands and what are the functions of hormones, how it is regulated, that things and all we will study in endocrine system. These systems one by one we are going to study in anatomy and physiology. Again in the second year you will study medical surgical nursing also. Once you study anatomy and physiology, it will be easy to study medical surgical nursing. That means disease conditions affecting this system. Next another important system, that is cardiovascular system. Here you are studying about the blood supply and heart and blood supply. Okay. And next lymphatic system, we will study about lymphatic blood vessels, not blood vessels, lymphatic vessels and lymph nodes. Okay, in this system we will study. You need an outline only here. We will study detail in later. Okay. And next system is respiratory system. Here we will study different organs connected to respiratory function like lungs, trachea, and bronchus, diaphragm, nasal cavity, different organs are there. We will study in respiratory system. Next system is digestive system. All organs related to digestive functions like stomach, mainly stomach, intestines, small intestine and large intestine, and pharynx, next till anus, from the mouth to till anus we will study in digestive system. And next one urinary system is, this is excretory system. Here main organ is kidney and urethra. We all study about detailed anatomy and physiology of this system also. Next male reproductive system and female reproductive system. And okay, till now these are different organ system in our body. I think you got an idea of what are the systems we are having in our body. These systems only we are going to study detailedly, we are going to study in upcoming chapters. Okay, next we are going to study some other positions. Okay, positions and planes. Actually you will not get questions from these topics, planes, positions and all. You will not get questions from anatomy, but you should know. I told you it's very, very important you to study another chapter. Upcoming chapters is dealing with like a positions, location and all. No, that's why you should know these terminologies first. Okay, anatomical terminology. First one, anatomic position is a specific body position in which an individual stand upright with the feet parallel and flat on the floor. You can see here lady standing in this position is known as anatomic position. Okay, here lady stands upright, straight position. Feet are flat to the floor, and feet are placed parallelly. Okay, this position is known as anatomic position or upright position. You understood? Next, the head is level and the eyes look forward towards observer. Somebody is observing her and she is looking that person. Okay, and head should be straight and looking, eyes should be looking forward. The arms are at either side of the body, the palms facing forward and thumbs pointing away from the bodies like this. Okay, straight hand, palms facing forward and thumbs facing away of the body. Okay, this is the anatomic position. You understood? Okay. Next one, what is meant by a plane? A plane is an imaginary surface that slices the body into specific section. Here you can see this is coronal plane, this is transverse plane, this is sagittal plane. Okay, this is sagittal plane like this. If you're actually we are not cutting the person, we are making imaginary lines. Okay, we are cutting in the center way, person's head in the center way. This is sagittal plane. Okay, this is sagittal plane. It will separate the body into two parts, right and left. Okay, understood? What is meant by sagittal plane? From front to this, front to back, we are making a cut or imaginary line. This body become two parts, that is, this is right side and this is left side, two plane, two parts. Okay, equally two parts. This plane is known as sagittal plane. Okay, you understood sagittal plane? What is meant by sagittal plane? We are making an imaginary line in the head of this person. Okay, from the head, frontal region to back occipital region. Okay, front to back. This way we are cutting and making two equal half portions, right and left. This plane is known as sagittal plane. Why this plane is known as sagittal plane? In some reasons are there. We will study in skeletal system. Okay, skeletal. When we are studying about the skeletal bonds, skeletal sutures and all, you will come to know. Okay, that and all we will study later. Okay, this is sagittal plane. Okay, second one, you see, if you are cutting to side, from left, right to left this way, if you are cutting this body into equal parts, means not cutting, we are making an imaginary line from in this way, it will cut into two equal parts, front part and back part. Is it? That plane is known as coronal plane, because coronal suture is here. In the coronal suture we are cutting, so it will make two equal parts, front side one part and back side one part. So this plane is known as coronal plane. Okay, understood? Coronal plane and sagittal plane. Next, this lady, we are cutting in this way, in the hip region, we are cutting in the transverse plane. This plane is known as transverse plane. And it will make two parts, upper part and lower part. Is it? Upper and lower part. This plane is known as transverse plane. These are the three important planes in our body. The planes means that is an imaginary line we are using to cut the person's or human body. Okay, coronal plane, sagittal plane and transverse plane. Okay, three major anatomic planes are refers to coronal, transverse and sagittal plane. Sagittal, coronal and transverse. Okay, next, sections and planes. Once again, I will tell you here. Coronal plane, also called frontal planes. Okay, is understood? The coronal plane means this is the coronal plane. In this way, we are cutting front and back two portions will form two portions like anterior front portion and back portion. Okay, in this coronal plane, otherwise we called frontal plane is a vertical plane. This is vertical plane and this is horizontal line. Is it? You know that this is vertical line and this is horizontal line. Is it? So this is vertical plane that divides body into front and back side, otherwise called as anterior and posterior. Front side of the body, when coronal plane divides the body into two parts, it will be dividing into two parts. Okay, division. Okay, and it will form front side equal half and back side equal half. Okay, front side is known as anterior. Okay, what you will call anterior, and the back side you will call posterior. Okay, It's very, very important while we are studying the anatomy of the simple organs. We will tell like this: anteriorly to this organ, this part is located. Posterior to this organ, this part is located. Like that, we have to study. This, you should know the meaning of anterior and posterior. Anterior means front side, and posterior means back side. Okay. Next plane, transverse plane. Transverse plane is also called cross-sectional plane. Okay, what is mean by what is the other name for coronal plane? That is frontal plane. Okay, frontal plane, and transverse plane is otherwise called cross-sectional plane or horizontal plane. This is horizontal line. Is a horizontal line. Horizontal line cuts, this horizontal line cuts perpendicularly along the long axis. Perpendicularly, it divides body and separating into two parts. This part is known as superior. Okay, superior means it is located in the upside. Okay, upper portion. This is inferior. Lower than this plane is known as inferior. Okay, the lower plane means inferior, upper part means superior. Okay, anterior, what is anterior means front side, posterior means back side, superior means upper portion, inferior means lower portion. You understood? Next one, sagittal plane. Sagittal plane divides into two equal right and left halves. Right side and left side. Okay, divides into two halves, that right and left half. Okay, sagittal plane in the body midline is a mid sagittal line. That and all is not needed. Just leave that. Okay. Here you can see a little more details about this. Related to front or back of the body, anterior in front of towards the front side. Anterior means this is a front side. Okay. Towards the front means anterior. Towards back means we will tell posterior. Okay. Dorsal means same way, dorsal and ventral you should know. Dorsal means at the back side of the human body. Dorsal means back side of the human body. Ventral means front side or belly side of the human body. Understood? Dorsal and ventral, some place you will see these words also. Dorsal means back side of the body. Ventral means front side or belly side of the body. Okay. Next, superior and inferior, you know. Superior means upper side, inferior means lower side. Okay. Caudal means, what is meant by caudal? Caudal means is near to the end of the spinal cord, tail end, because that means our sacral region. You know the end portion of vertebral column is it. That place is known as caudal. That and all I will tell you different terminologies. I will show the picture in the textbook and I will tell you now. This next, cranial means, now you just listen these slides. After that I will show you different region, but you should not by heart these things. Just understand this whole chapter, this not whole chapter, this positions, planes and all, just to understand. They will not ask questions from this area. Okay, cranial means related to head. Cranial means related to head. Okay, medial means midline. Okay, midline of the body. Lateral means side of the body. Lateral. Deep means inside of the body. Okay, deep means inside of the body. Superficial means outside of the body. Okay, superficial means outside of the body. You know this terminologies. Medial means center of the body. Lateral means side of the body. Deep means inside of the body. Superficial means outside of the body. You just understand these terminologies. Next, what is meant by proximal and distal? Usually this proximal and distal will come when you will study skeletal system. There you will be studying different bonds. So they will tell the proximal end of the bond contain this one. Distal end is attaching with this muscle, this tendon, like that and all. They will explain. That time you should know what is mean by proximal and what is mean by distal. Proximal means upper portion, distal means lower portion. Understood? Proximal means upper region and the distal means lower region. Okay, proximal end of this bone means upper end of the bone. Distal end of the bone means lower end of the bone. Understood? Okay. Okay, appendicular, axial and all we will study later. This picture won't be clear for you. I will show you another picture. Okay, another thing here you can see. Okay, and first we will go to textbook and see the regions. Okay, just 1 minute. Here, what and all I explained, the same things are here. Proximal means upper portion, distal means lower portion, medial means center portion, lateral means side portion, proximal means upper portion. Okay, see here in this bone we can tell this is upper portion and this is distal portion. Okay, proximal and distal. If we are talking about hand bones, this is proximal portion and this is end portion. Okay, each and every bone having proximal and distal. Okay, next in this also you can see this side is anterior or ventral and this side is posterior or dorsal. Okay, this region, caudal region, because it's the end of vertebra. Cauda equina will come here. That and all we will study later. Okay, don't get tense now. After hearing these new words, you should not be tense. It's very easy. I will explain you everything later. Okay, one by one. This is only in this chapter is only for introduction, just to understand the positions and the terms. Okay, later we will discuss one by one. If you are not understanding now also, no problem. If when you are going the next unit by unit, no, then you will understand. Okay, this is caudal region. And you know superficial and deep. Superficial means the superficial region, that is skin region or outside region, body surface region, that is superficial. If we are talking any organs inside our body, then we can tell it's deep. Okay, deep things. Okay, here you can see actually the body is divided into two in this way. This is coronal plane and equal parts. Okay, frontal or coronal plane divides like this. Okay, this is frontal or coronal plane, this is sagittal plane. Okay, this is transverse plane. Understood? Okay, next we will see different cavities, anterior posterior and all, you know. Next we will see different cavities. Okay, here you can see, first you should know some cavities. Cavities means some spaces in our body. Spaces, and these spaces covered with the different types of membranes. Okay, just to have an idea about that. Our body contains cranial cavity. That means the space where brain located. This space is known as cranial cavity. Understood? Okay, next one, vertebral canal. What is meant by this canal? This vertebral column, inside the vertebral column we have a space, we have a canal, we have a tube like space where there which one is located, which organ is located? There is spinal cord. This is a space for spinal cord. This canal is known as vertebral canal. That also one cavity only. Another one is thoracic cavity, where our lungs are located. That's the chest cavity, that is thoracic cavity. Our lungs are located in this cavity, thoracic cavity. Okay, next again the down, once you come to down of the body, there is one space is called the abdominal cavity. All abdominal organs are located in this region, in this space only. So it is known as abdominal cavity. Next, in the lower part of the abdominal cavity, one more space is there, that is pelvic cavity. Different types of reproductive organs and are located in pelvic cavity only. Okay, pelvic cavity, this is a space, or this space is called pelvic cavity. What are the different types of spaces or cavities in our body? Cranial cavity, which holds our brain. Vertebral column, which holds our spinal cord. Thoracic cavity, which hold our lungs. Abdominal cavity, which hold our digestive organs. Pelvic cavity hold our pelvic organs or reproductive related organs. Okay, these are the different cavities in our body. Each and everything we will study later. Okay, each cavity is covered with one thing. You just to understand, each cavity is covered with different membranes. That and all. Now I am explaining also, you will not understand. While you are studying each and every system, we will explain very detailedly. Okay. Okay, understood this cavity, or just to have an outline. Later we will study. Once again, this is a very important abdominopelvic region. When we divide our abdominal region into 9 quadrants, like this we are dividing. Okay, Here you can see it divides abdominal and pelvic region divided into 9 quadrants, 9 divisions. Each quadrant have name. First we will see the center portion where is our umbilicus located. This region is known as umbilical region. The same way this is lumbar region also. Lumbar vertebrae will come in this region only, back of this umbilical region only. So in the right side of the umbilical region is known as right lumbar region. Left side of the umbilical region known as left lumbar region. Understood? Center portion is umbilical region and the right side of the umbilical region is known as right lumbar region because it is near to lumbar vertebrae. Okay. Next, left side of the umbilical region is known as left lumbar region. Okay. Next, upper side of the umbilical region is known as epigastric region because it's above the stomach. It's just above the stomach. So it is known as epigastric region. And lower part of the umbilical region is known as hypogastric. Hypo means lower. Hypo means lower or less. Both meaning it's having hypogastric region. Understood? Epigastric region, hypogastric region. Okay. This is here one bone is known as iliac. When we study about pelvic, you will come to know that about the pelvic organs and skeleton system. That time we will study iliac bone. So this region, right side of the hypogastric region is known as right iliac, I-L-I-C. Iliac region. This is left iliac region. Right iliac region, left iliac region, right lumbar region, left lumbar region. Here you can see hypochondriac region. Right hypochondriac region, left hypochondriac region. Understood? Right hypochondriac region and left hypochondriac region. This region should be knowing. Okay, you should study this region. It's very, very important. Center portion. Once again, I will tell you. Center portion is umbilical region and the upper portion of the umbilical region is epigastric region. Lower portion is hypogastric region. Epi and hypo. Okay, epi and hypo. Okay, in the umbilical region, right side is lumbar region, left side is left lumbar region. Here also, hypogastric region, right side is right iliac region, left side is left iliac region. The epigastric region also, right side is right hypochondriac region, left side is left hypochondriac region. These are the 9 partitions or 9 compartments of abdominal pelvic cavity. Okay. Okay, these and all we have to study in the, it is only half portion of the first unit finished. Second half is very, very important. The first half, till now what you study, no, that is only outline of our body. Actually, they will not ask direct questions from this area, but you should know the positions, planes and locations to study future coming chapters. That's why I explained in this video. Next class or second part of first unit of anatomy, we dealing with cell. It's very, very important. Cell. Next one is tissue. That also another important portion for exam. They will ask in the coming classes what you are going to study. The same thing they are asking in the exams. Okay. First you study this till now. 1 or 2 times you take the video and watch it and just make a smart lecture notes. It will be very useful for your future studies. Okay, share your, if you like the video, just like it, and if you have any comments or suggestions, write it. And if you didn't subscribe, if it is useful in this channel, please subscribe our channel. Please share to your friends also. Okay, thank you for watching. Bye bye.